person has the right to the highest attainable standard of health, including the right to healthcare services. Further aware that mental health is a key determinant of overall health and socio-economic development, recognizing that the Constitution assigned to the national government the responsibility of matters of health policy, concerned that according to the World Health Organization, mental and neurological disorders are common, and about 10% of the population at any given time suffer from at least one mental disorder, noting that patients attending primary care clinics may have diagnosable mental disorders. Deeply concerned that psychiatric units are only available in a few counties, indicating that patients seeking services at all healthcare facilities in most facilities have limited or no access to mental health care services. Acknowledging that efficient access to healthcare facilities leads to improved overall health, increased economic productivity, social equity, and improved quality of life. Now, therefore, this House urges the national government through the Ministry of Health to collaborate with the county governments to develop a policy that will integrate mental health services at all levels of healthcare facility to enable all citizens across these services. Honorable Madam Speaker, the mental health crisis in Kenya has reached a critical juncture, and it demands urgent and comprehensive action from the Honorable House. The statistics highlighted are deeply concerning. 1 in 4 Kenyans is suffering from a mental health condition, and a significant portion of outpatient cases are related to mental health issues. This crisis has far-reaching implications for the well-being and prosperity of our nation, Honorable Madam Speaker. Honorable Madam Speaker, the right to the highest attainable standard of physical and mental health is enshrined in the Constitution of Kenya 2010 under Article 43(1)(a), which clearly states that every person has the right to the highest attainable standard of health, which includes the right to health care services, including reproductive health care. However, the reality on the ground points a stark picture, Honorable Madam Speaker. Madam Speaker, I stress the urgent need to tackle Kenya's mental health crisis. The Mental Health Act of 1989 and the National Mental Health Policy of 2015 provide a framework, but they face weak enforcement, unclear financial support, and conflicting laws. These hurdles contribute to the crisis, with 1 in 4 Kenyans suffering from mental health issues and frequent tragedy. To fix this, I propose reforms and a strong action plan to protect and support people with mental disorders, including more resources and updated policies. Honorable Speaker, for instance, I came to learn that this problem cut across all counties in Kenya, that although our counties might have 1 or 2 mental health facilities, but that even the supply of drug is erratic with frequent shortages, with more counties and having 1 or 2 mental health specialties. For instance, in Kilifi, for example, they found that it only had 2 mental health nurses for a population of approximately 1.2 million people. Madam Speaker, the lack of mental health infrastructure and human resources had a devastating impact on Kenyan communities. Madam Speaker, I want just to note some cases which have just happened in Kenya regarding mental disorder. On 24th January this year, a 34-year-old Evans Master was found dangling from a tree in Kisii. The same day, 72-year-old Maina was also found in Kirinyaga from a suspected suicide. On the very day in Mituni location, Machakos County, David Mutua was found hanging on a sisal rope, dead, Honorable Madam Speaker. Madam Speaker, also on January 2nd, 2024, in Kangema Police Station, Murang'a County, a police constable shot himself dead. That same day in Gusishi Police Station, Meru County, Corporal Simon Gitonga was found lying in a pool of blood, dead from a self-inflicted gunshot wound to the head. Honorable Speaker, also one case happened at the Lunga Police Station where a police officer shot his wife and also shot himself dead. April 23rd, Oliver Naseria in Kitengela, a 24-year-old living in Kitengela, in a bizarre incident, killed her 2-year-old and consumed her organs all the time, singing and reciting alphabet as the neighbors watch helplessly. Madam Speaker. Madam Speaker, the crisis extends beyond the tragic loss of life. The frequency of mental health issues in our learning institution, such as the cases of love triangles among university students, the issue of femicide, and the mushrooming of juvenile gangs. This disturbing trend are a clear indicator that the mental health challenges facing our youth are not being adequately addressed, Madam Speaker. Madam Speaker, furthermore, I raise concern about the impact of mental health issues in the workplace, where cases of assault, gender-based violence, and employee absenteeism due to depression are on the rise. This not only affects the well-being of our workforce, but also a significant economic implication for our nation. Just to note, Honorable Speaker, I sit in the Parliamentary Service Commission on the Committee of Staff Welfare. Honorable Madam Speaker, we have several cases of mental disorder, be it anxiety, be it depression, and bipolar. And we are yet to have some solution on these cases, Honorable Madam Speaker. Madam Speaker, the existing legal and framework, such as the Mental Health Act of 1989 and the National Mental Policy of 2013, are outdated.
Honorable Mishi Mboko, you know you've proceeded to debate your motion before we even propose the question, then open it for debate. So if you can just wind down. You're just supposed to move it as is.
Yeah, when you are moving, what I understand, Honorable Madam Speaker, you move.
Hold on
I'm
one
okay.
second. What's your point of order, Honorable Chepkonga?
I'm okay.
Thank you very much, Honorable Speaker. You know, Honorable Mishi Mboko is my very good friend. The way she's going about it, she's doing very well. But she's reading, you know, you just need to have a cursory look at your notes and then not read. Those are the standing orders, and I'm raising pursuant to standing order 83, Madam Speaker. She doesn't need to read everything. She just needs to have a cursory look. You know, it is a debating chamber. It is not a reading chamber. So she needs to just to make a cursory look at the points and then present the points.
You've made your point. Okay, proceed, Honorable Mboko.
Coming. Madam Speaker, I understand the standing orders, and I know when you are moving a motion, it's not that I am debating this motion. I am moving. And when you are moving, you can read, you can look at your notes, you can do it without looking at your notes, so I don't have limitation on that. When if it was debating this chamber, then you are not supposed even to look to the notes. You are just supposed to debate.
Proceed.
Honorable Madam Speaker, morally we have a duty of care to our citizens, especially the vulnerable, to ensure that mental well-being is prioritized and safeguarded. Honorable Madam Speaker. Madam Speaker, the tragic cases I have highlighted are a stark reminders that mental health is not just a personal issue, but a societal one that has far-reaching consequences, Madam Speaker. Madam Speaker, it is therefore mandatory upon the Honorable House to take decision action to address the mental health crisis in Kenya, the most including but not limited to the following. And I want to talk about some reforms which maybe if we can take them, it can assess us in ensuring that we fight this menace, Madam Speaker. Madam Speaker, number one, allocating adequate resources, because we have found this is a big challenge, but financial and human or mental health infrastructure and services, including the establishment of standard-alone mental health facility. This is what we don't have. For instance, in Mombasa, we have only the Portrees Center for mental disorders. It is very small, there's no capacity, the medical professionals are not even available, we don't even have drugs. And the same in other counties. I've also mentioned about Kilifi, what we have seen. Madam Speaker, number 2, integrating mental health into primary health care to improve access and reduce the stigma associated with seeking mental health services. Honorable Madam Speaker, there is a lot of stigma. Even here in the parliament, I know some of us might be suffering from mental disorder, but we cannot disclose it, we cannot maybe share, but we are just suffering from this disease. Honorable Madam Speaker, it is high time we have to do something on this. Number 3, conducting robust research and data collection to understand better the scope and drivers of the mental health crisis, which will inform evidence-based policy making. Honorable Madam Speaker, we need to, in fact, like here in this parliament, we need to have what we call well-being. And under well-being, we need to have a unit or a center to ensure that we tackle these cases of mental disorder. Most of our staff, and in regard to absenteeism, it is because of mental disorder. Right now in the parliament, in the Parliamentary Service Commission, we have like 7 cases, and all of them are on depression issues, Madam Speaker. Madam Speaker, number 4, reviewing and updating the Mental Health Act and National Mental Health Policy to align them with the Constitution and international best practices, Madam Speaker. Madam Speaker, another one is launching public awareness campaigns to destigmatize mental health and encourage Kenyans to seek help without fear of discrimination or social ostracization. Honorable Speaker, number 6, establishing robust mental health support system in learning institutions, workplaces, and other key settings to proactively address emerging challenges. We have seen what has been happening in our learning institution, in our school, in our universities, the love triangles, and so many other cases which have just happened regarding, and this is because of mental disorder which has not been addressed adequately, Madam Speaker. Honorable Speaker, the time for action is now. We owe it to the people of Kenya to prioritize their mental well-being and create an environment where they can thrive free from the burden of untreated mental health condition. I implore this Honorable House to take the necessary steps to address this crisis and ensure a healthier, more prosperous future for our nation. With these many remarks, Madam Speaker, I beg to move and call upon Honorable Catherine Omanyo to second this motion. Thank you, Madam Speaker.